Good morning, everyone. This is Lisa Hurley from York County Development Corporation. We are pleased to have you join us for this week's Community Sector Upbrief for York County, Nebraska. I would like to kick off this morning with Laura talking, but first, as a reminder, this is live on Facebook. It will be available for viewing there, plus on YouTube later today. If you have any questions, please feel free to chat it in. We will get to your questions, get them answered. And now, Laura McDougall from Four Corners Health Department.
Good morning, everyone. Glad to see everyone this morning on here in January. I wanted to spend some time this morning talking about the vaccine. So we'll start off though with the current situation in terms of cases and where we're at. I think I'm very encouraged to say that our case numbers have really been coming down consistently. We have still, we are seeing that we're on something of a plateau, but this last week, I think we've taken another, the decrease in numbers of cases. So that's definitely a positive thing. And as I was figuring our numbers for the press release last night, it took me aback that in the previous 7 days, we actually went to double digits instead of being in the triple digits. So 94 cases recorded in the past 7 days. Back in November, we had a day where the 1 day count was higher than that. So just glad to see that coming down. York County is having probably some of the highest number of cases, and we're at the moment, and some of that's due to we're seeing some cases in a facility that will not be impacting the rest of the population. So as you see press releases coming out in the next days, and we are having an outbreak in a situation where the facility is not, it wouldn't be spreading to the rest of the community. So just keep that in mind. The total number of cases for our district and over time that have been recorded has gone now above 4,500. So we did hit that milestone last weekend. And we are now, as of last night, at 4,554 cases. All right, so, but encouraging to really see the transmission. It continues to decrease in our communities, which is very good. So testing is going well from our perspective. I will, we'll hear from the hospital here too, and Test Nebraska, and our medical providers here in the call they can elaborate further on that. I do want to talk some about vaccine. And the vaccine is really just been still trickling in. We have though made some ground and been able to get through our phase 1A. And on our website, you can go in and see exactly what the plan is laid out to address the different phases. So we are wrapping up phase 1A. Of course, we have a few people now and then that pop up that still are from phase 1A that we're taking care of. But at this point, we're really waiting for the vaccine to come so that we can start in phase 1B. Now, our first shipment of vaccine that we're getting for phase 1B, it's not a great amount. So, but we will be starting phase 1B when we get our next shipment of vaccine. We've given all the vaccine that we have at the moment. We did get a shipment of vaccine to work on the second shots for those phase 1A. So that activity has been continuing. So that would be wrapping up and completing the vaccinations for phase 1A. And we will, though, with the next shipment of vaccine, start on phase 1B. So if you are curious what phase 1B looks like, we do have that on our website. you can click on the vaccine banner at the top and it'll take you to a page that has all kinds of information on there. In addition to the different phases and who are in those phases, we also have a link that you can click on if you want to register to be on the waiting list to receive vaccine. And there's also, if the internet isn't the way you'd like to do it, you can also definitely call us and we can put you on that waiting list. Right now, we know that we have a lot of people that are 65 and over that are on that waiting list. We actually have more than 5,000 people already on the waiting list who've called in or registered to be on the waiting list. We are waiting at this point for an internet registration system to be stood up by the state. And once that becomes available, that will be a really nice way to also schedule for a vaccine. But if you have put your name already on our waiting list, we know you're there. And please just be patient though with us because we're just simply waiting for vaccine. And if you want to see the order in which we're going to be doing our vaccinations, that phase 1B is posted on our website. So we're going to be following that diagram definitely on how we approach vaccinating people. And we do have all of our hospitals in our district, the Polk County Health Department, the York Medical Clinic are all the partners that are in this effort to vaccinate everyone in our district. So we will be we're all using the same phasing guidance on how we're going to approach this. So again, please be patient. We are not sitting on vaccine. It is going into people as soon as we get it. And just know that we are getting, we are really limited at this point by how much vaccine we have. And then we have a question here from Melanie. Hi, Melanie. Have you seen many allergic reactions during vaccination process so far? No, we have not seen any allergic reactions yet at this point. We have seen some people who've had some of the sort of side effects because of the vaccine, and a lot of those people, it's been a sore arm or some people have sort of had flu-like symptoms, like a fever maybe the next day, a low-grade fever, just feeling achy and things because of the vaccine. We know that that can happen, and often if you've already had COVID, you might kind of want to expect that just means that your immune system is gearing up and it's acting on those that vaccination, and your immune system's doing what it's supposed to do. So those are really just the side effects we've been seeing in some people. Many people have been taking this. Most of the people have been taking this vaccine with absolutely no problem. So other than a few of those side effects. Okay, and so of course I'm happy to take any questions, but I think I've pretty much covered what I wanted to. I have one really positive thing that's happened in our office this past week too, is that we have 3 National Guard members who have been sent to us to help with this vaccine rollout. So, and they're on a red screen here this morning. They're behind the red screen, the 4 corners screen. They're getting acclimated to our district, and we're going to listen in on the briefings so that they are getting their feet underneath them here at our department. So if we need help if you're on our list, you may be getting a call from someone from the National Guard to tell you to come in for a shot. And they're going to be helping us move vaccine around, helping us with our vaccine clinics. So we're really excited to have them here. There's 3 of them, and they'll also be available to help our partners roll out the vaccine. So we're very grateful for that. They'll be here through March. And that was some really good news we got. And other than that, I'm going to turn this back over to you, Lisa. Thank you.
Thank you very much, Laura. I'm not seeing any questions on Facebook at this point, so we will move on to the medical sector. And I received an email from Lisa with Henderson Healthcare. She said they are continuing to do the required testing in their long-term care employees on a weekly basis. Overall, they are also getting new strategies in place for their remodel and construction phase of the hospital and the clinic area. So that's pretty exciting, some big news for the county. And then I will turn it over to Jim so he can provide the York General update.
Thanks, Lisa. Good morning, everybody. Been reporting here on the statewide hospitalizations too, just that trending. And as of the 20th, 433 COVID-19 patients were hospitalized in Nebraska. Last week, that was 449. So hospitalizations have been between 517 and 429 since January 1st. I echo what Laura says about some plateauing a little bit. If you would look at it on a overtime bar graph, you would notice some more normalization in that area of the, the high 400s and down to, like we said, 433 now. And we'll see if it can get down below 400 because that, according to the DHHS website, that triggers kind of a blue level of DHMs, which Laura, I'm not exactly sure everything that'd be involved in that, but it would be less directed health measures at that point. So we'll see where that, if we can get down below that soon. And since put a little perspective on it, back on the 20th of November, there were 987 individuals hospitalized statewide. And so that's over 56% decrease since that time. So it's very good to see. And we've certainly noticed that in resources, healthcare resources that we've had to use too over time. So very helpful. So from the 12th to the 18th, we had tested through our drive-through testing 65 individuals and had 10 positives. That was about a little over a 15% positivity rate. The week before it was 73 individuals. Well, I just took a few minutes here and looked, and as of the 19th, this is how these trends change very quickly. And on the 19th, just the 19th alone, we had tested 13 individuals and only had one positive and one pending. And so if I look at a new rolling average that would have gone from the 19th and go a week back, we had tested only 58 individuals and only had 5 positives over that time. That's less than 10%. So that's very encouraging to see. Let's hope that that keeps up that way. We did test between 40 and 50 yesterday at Test Nebraska. And I think those have been a higher positivity rate traditionally for us. And I bet that's, maybe that's going to continue the case this week again. We'll see. But our numbers there, and I know district-wide too, our Test Nebraska numbers are down as well. So I think the testing volume has been down throughout our district. So over the period of the 12th through the 18th, in our ER, we saw 2 COVID positive patients that were discharged home, 3 that were admitted, and 1 transferred to Bryan. And on the patient floor, we saw 4 COVID positive patients admitted, 4 discharged to home, and we still have 3 inpatients as of yesterday. We have our safety huddle going on right now, so I can't tell you what we have today right now, but we've been hovering around that 3 COVID inpatients. And we have infused 7 individuals with what I'll call the BAM drug, which is that monoclonal antibody, and been very effective, that treatment that we've had too. So currently, we only have 4 employees off due to COVID-related reasons. That's significant to note because 3 of them being positive, 1 out for exposure. Our peak at one point was over 30 individuals that were out. And so if we, knock on wood, don't have any additional positive organization, we'll drop down to 3, I know, by Friday. And so we're just hopeful to continue to chip away at that. So vaccines, again, as Laura had talked about, round 2 of our vaccines are going on right now over at our old dialysis center, which we have up to 18 chairs. And we can run through a lot of individuals through there in a safe fashion. It works very well. We expect around 150 today that'll go through. And I think that's, we'll see how many we actually get through today. And but it's very good to see. To date, I know we have over 60% of our hospital and rescue staff that have received the vaccine and are going to start getting the second vaccine. At the Hearthstone, over 70% of our employees and over 95% of our residents now have received their second dose that occurred yesterday. And at the Willowbrook, that's in the high 80s as well, or high 80s of employees for percentages, and 100% of the residents that have received their second dose. And so we've seen the second dose already through our nursing home and assisted living and coming through our hospital, and the rest of, as Laura reported, those other individuals on phase 1A as well will begin. I know we've got clinics spaced out over the next couple of weeks too that are going to be delivering the second doses. So currently, some more good news. The Hearthstone, knock on wood, if you can hear that, no positives residents or staff right now that are no restrictions. We're all green zone restrictions under COVID. That's the least amount of restrictions we can have in every neighborhood of the Hearthstone. And we haven't been that way for a while. I know at one point in time we were over a dozen employees and I think 9 residents for one time that were positive. So I don't know how you get much more of a decrease than going down to 0 on that at this point. So let's hope that it hangs on that way. Same thing for Willowbrook, doing well there also. And at both the Hearthstone and Willowbrook, we're trying to get portico visits going with some heaters out there for the nursing homes. Can't quite have, because of our positivity rate in the county, can't quite have indoor visits yet. But the assisted living we can, and we're just having them in the front entrance behind plexiglass and everything too, that we're able to get the residents and the families to, to do some visits too. So we are continuing, as Henderson is right now, because of the positivity rate in our county. We're doing twice a week testing of the Hearthstone, and that continues. But like I said, so far things are going well in that regard in the last week. So I believe that's all I have today. Lisa, thank you.
Thank you, Jim. Is there anyone else on from the medical sector that would like to speak today? Okay, we will go straight into the education sector. Mitch, Brad, are either of you on? I'm not seeing them on, so I'm guessing they both got caught up in their schools this morning. I did receive a message from York College that they have no update. In Southeast Community College, they continue to look for a new coordinator. So if you know of anyone that would be a good fit, please make a referral there. It's on our website. They can go straight to Southeast Community College's website as well. So we'll move on to the local government sector. I'm not seeing Randy on. Feel free to speak up if you are there. Otherwise, we'll go straight to Barry.
Good morning. I don't have a lot to say. I guess everybody read in the paper that we extended the mask mandate for York last week until the end of February. Definitely had an interesting meeting, but we got through it, and I still think that Mass Matter and people doing this is making a difference, and it's really great to hear the optimism in the conversations about the cases and vaccines getting out and all that. Before I forget, I wanted to mention, I thought there was a Rex Rasmussen in yesterday's York News Times had submitted an editorial from his hometown newspaper from 1963. And if you didn't get a chance to read that, I think it was very interesting, and it talked a lot. There's been a lot of talk about individual freedom, of which is talked about here, but it also, this editorial talked about individual responsibilities. And I think if you didn't, I really appreciate Rex submitting this, and it was from a George Peterson, who's now deceased, but he was the publisher of the Sherman County Times, and Melanie printed this and the newspaper printed it. And I just think from 1963 how pertinent it is to what's been going on today. If you just try and click on that or grab the paper and read that, it's worth a couple minutes to do that. So from a city standpoint too, I would just, we continue to try and fill some open positions where we have struggled to get the applicants that we've been looking for. We're continuing to work on that, and we know that we need to have a few more feet on the street in some areas that we've been a little lax. So that will continue to be our focus over the next couple of months, along with all the other projects that are going on right now. So with that, I wish everybody a good day and a great rest of the week. Thank you.
Thank you, Barry. And I'm just going to add to Barry's here, for any of you that are LinkedIn users, I have shared the city administrator position on LinkedIn. Feel free to go in and share it, because all of our connections, you just never know where it's going to hit. I don't have any reports from any of the other communities, so we'll move into the faith community and nonprofits. I do know Jake wanted to say something this morning. So Jake, it's yours.
Thank you so much, Lisa. I wanted to take just a moment here at the York County Health Coalition, make sure everybody is aware. We do still have funds available for financial relief for people experiencing hardship due to COVID. We are still taking a very broad definition of a COVID hardship. If you think COVID has impacted you financially, you're probably right. The funds still remain, as well as our usual community response, which is our program where we provide general financial assistance, also always has funds and is always available. We just wanted to make sure the community is aware that those funds still exist, because we have seen a little bit of a slowdown in referrals, and that's not necessarily a bad thing. We would love for it to be a good sign, but we want to make sure that if it's not a good sign, if people do still need that assistance, it is available. We do want to make it available. We want to help out. You can find us on Facebook, the York County Health Coalition. You can call our office, or we actually have a direct line that I will put up in the chat here to our community response program. And that'll go straight to our coordinator, Brittany, who works with all of that. So just wanted to make sure community is aware. We're hoping the slowdown is a good sign, but just in case, we're still out here and we're still really wanting to make sure we provide assistance so that nobody is seeing utilities shut off, losing homes, any sort of financial hardship because of this sickness.
Thank you very much, Jake. We appreciate the update. So we will move on to the business sector. I have just a couple of things. There is funding for the PPP program. So I do encourage you to continue to work with your bankers to see if you need it and if you qualify. It looks like Jake did just he put in his phone number. And for those watching on Facebook, the phone number for the Health Coalition is 402-363-9946. Okay, so now back to businesses. Continue to work with your banker if you need the PPP funding. If you need some technical assistance, whether it's analyzing your market, how to navigate your employees through. I know that the tax credits for giving your employees time off for COVID is still in place, but it's no longer a requirement that you have to give your employees 2 weeks off for quarantine or paid paid time off, but the credits are still there. It has to be documented in a certain way, so make sure you're working with your accountant if you have had people in quarantine or if that continues to go forward. And then a non-COVID related announcement is our 17 county podcast season 4 released this morning. In this season, it's going to center around the stories that come out of your college, the alumni, the athletics, the professors, just kind of how your college impacts York County. I want everybody to understand the reach of the podcast. We're 1 year into this beginning of the 4th season. We have listeners in 7 states, and over 50% of our listeners are from outside of Nebraska. What that means is those people probably have a connection back to Nebraska. Maybe they're coming to York County, Henderson, McCool, City of York, wherever, to visit family or friends, but they're paying attention if they are our podcast. So just remember customer service when people are in. A lot of times people will visit a community as a tourist before they make the decision to relocate. And I know, as you've heard today, many of our employers are looking for employees. So we're very happy with what the podcast has done for us and for the community, and we're excited to see how it continues to expand. I really don't have anything else. I'm going to turn it over to Madonna right now.
Thank you, Lisa. I just want to first kind of dovetail off of your York College comment. Our young professionals are hosting Lattes with the Leader, but it will be virtual, and featured will be Dr. Shannon Linen with York College. If you have any questions, you can certainly contact our office as to how to receive that invitation to join that. Our young professionals have just been really doing a great job maintaining connections through all of this past year, and look forward to expanding those next year. Our team also here will be hosting our Let's Connect on February 2nd at Pizza Hut. That is limited to the first 30, just because everything we do is based on current measures, and we work within those. And our team will be going out to the convention center Friday morning to do some walkthroughs with their team out there to be able to effectively and safely set up the home show. Our office also is having a help wanted. Christy has taken a position that is pretty good fit for her. So we do have our part-time admin position open, and I welcome anyone that is looking for a part-time position. It comes about 10 to 2 to reach out and let me know. Have a great day, everybody, and a wonderful weekend.
Thank you, Madonna. I am not seeing any questions and comments anywhere. So we'll just wrap this up unless Laura has any final comments. I want to thank everybody for joining us this week. We will have another meeting in 2 weeks. I don't know what the date is, to be honest. I haven't looked that far. But 2 weeks from today, same Zoom link, same call-in information, unless we notify you otherwise. Everybody have a fabulous weekend, and we look forward to seeing you next time.